we are going to be talking today about internal family systems therapy. And this is a really fascinating approach. It's got lots of different nuanced angles, and it's really become very popular over the years. I remember when I first entered the field, I guess I was 1992, 93. Like, this was really big at all the conferences. And it really has become, I think, increasingly a popular approach. It originally developed working with trauma. And, one thing I'll say is that people tend to either really like it or they're like, I just don't get the language piece. But, and I also think it's funny, when I did my latest 4th edition of Mastering Competencies in Family Therapy, I put it back in. So you'll see IFS. I don't think it's in the 1st edition. I think it's in the 2nd edition. And when you update a textbook, if you add anything, you have to take something out. And so I took it out of the Mastering Competencies because I had a longer textbook called Theory and Treatment Planning in Family Therapy, and I kept it there. But then, because I had to take it out so I can put in evidence-based treatments and some new chapters on that. And then finally, when I went back this time for the 4th edition, I argued with my publisher, saying I have to make it longer because there's so many new theories, and yet the licensing exams, especially the national exam, is on all these old theories. And so they gave me permission, so I got to put it back in the 4th edition. If you're looking for IFS in my books, it's in my MFT books, not in my counseling textbooks. But it's really, a really interesting theory. And I had it under experiential family therapy in the 2nd edition. And I think it's still in there in Theory and Treatment Planning. I think of it as a fairly experiential approach, and you'll see why as we get to it. But for the 4th edition, I had Virginia Satir in experiential for family therapy. I had Carl Whitaker, symbolic experiential, that you have to keep in there because it's still very much on the national exam, even though it's one that you really can't get trained in very much these days. And I had emotionally focused couples therapy. And then Sue Johnson went and added all this new stuff. So my experiential chapter was just jam-packed. And I'm like, oh, I can't fit IFS in there. And so I said, where else could I put it in the book? And I thought about it. And I ended up putting it in the psychoanalytic and Boehnian intergenerational chapter, in with psychoanalytic, because when you think about IFS and how it's working with those internal parts, even though the language is totally different, if you're familiar with my work, I'm really into the Unifying Framework. What we're doing here is very similar, with totally different vocabulary, but very similar conceptualization process to what happens in psychodynamic therapy. So, and I do think psychodynamic therapy has, by far, hands down, I mean, systems is a close second, but psychodynamic has the most complex concepts and languaging, right? I don't know if it's not like the complexity gets you all that further. But I think if you're interested in psychodynamic, but you want something that's just more user-friendly, more 21st century friendly, I think you're going to find IFS really does that work in a simple, fun, easy to use way. So lots of really great stuff with IFS. And so I'm just happy that you were here to learn about it. Oh, Leah just posted a question, and that is a great question. So IFS is not on the California MFT licensing exam. It could show up as one of, I think, a more minor theory, but it could show up on the national exam. So for the other 49 states use the national exam, there's the California exam. I don't think you're going to see it on the California MFT exam, but you might see it on the national exam. And if you're, those of you who are in my Laugh Your Way to Licensure course or know about it, I have what I call, priority 1 theories and priority 2 theories. And so priority 1 theories is like, this thing is showing up on the exam and you should know it, know it cold, know it really, really well. And so if you don't have a lot of time to study, I say just focus on those the priority theories. And I would put IFS as a priority 2 theory. It might show up question or two. It may even just be an answer, maybe be a wrong answer someplace, right? Because theories can show up in strange ways on national exams. So this isn't one you need to go crazy to study. I think if anyone listening here is taking their taking a licensing exam, the national AMFTRB exam, it's not bad to know. But I certainly find that there are a lot of people who have a lot of enthusiasm for this approach, and even just the use of parts language, right? Which I would say Gestalt therapists use this as well. another form of experiential therapy. That's why I think of this as more experiential. But this language I use a lot, even, in my work, which I think could broadly be considered, very postmodern, that even in kind of using a postmodern approach, when you're looking at dominant discourses and narratives, that this part language, in terms of how people construct their identities, is very useful and practical. Okay. Excellent. Okay, so let's go ahead. And I guess I should introduce myself just for anyone listening who doesn't know me. My name is Diane Gehart. I run the Therapy That Works Institute, and I have textbooks out called Mastering Competencies in Family Therapy, and I have Theory and Treatment Planning in Family Therapy. And I also have 2 counseling textbooks, Theory and Treatment Planning and Counseling and Psychotherapy, and Case Documentation. So just in case you ended up here and you didn't know who I was. So let's go ahead and get started. So in a nutshell, the least you need to know. So what is happening with an IFS is that we are applying systemic thinking. So systemic thinking is kind of the foundations of family therapy, and we're applying it to the intrapsychic world rather than the interpersonal world. Interpersonal is between people. Intrapsychic is we're applying it to our inner world of self. Okay, and so this is really kind of an interesting concept. And so the fundamental principle of this approach or premise is that each person's inner life, so our internal dialogues that we're having, that we have these multiple parts. Like if you ever just, I do a lot of meditation. If you follow my work, I also do a lot of work with mindfulness, where you sit down and watch your mind. And your mind is like constantly like having this dialogue all day long, right? Just this inner chatter. And you'll notice if you sit down and practice a little mindfulness watching your inner chatter, that you can have multiple opinions about the same thing. You can have contradictory feelings about the same thing. You can, be all over the place around the same topic, right? And so it's conceptualized in this approach is that we have different parts of ourselves, maybe a very brave part, a fearful, worrying part, we can have feminine parts, masculine parts, we can have all these parts, right? And that all of these parts actually function according to systemic principles that are very similar to what we talk about when we look at family systems, right? So that inner system you have is going to have some very similar dynamics to the outer systems that we talk about in family therapy. And so the goal of this approach, or the goal of therapy in this approach, is to help a person move from managing their life being very reactive with all these parts kind of being triggered to being led by what they call the self. And actually that should be a capital S. My apologies. I thought I caught them all. And oh, you know what? I sent this to my assistant, and I hope she didn't uncapitalize them all because I didn't proofread for that. So that's possible. But anyway, that should be a capital S self. So they conceptualize this part of us that is the self, this which we'll talk about as we go through. But so the goal is to be able to be not reactive, but live from this centered part of ourself. And so we're choosing responding rather than reacting. And for those of you who are familiar with my unifying framework, and even if you're not, we're going to I think this is so much fun this was eye-opening for me when I put this table together for this presentation. So I have a unifying framework for psychotherapy. There are a couple videos on YouTube. You can find it there. I talk about these 4 basic levels. There's a behavioral level, an emotional, cognitive, and societal level, and that each level has 2 parts. And it's really fascinating. So what we can do is map every single theory in the world across these 4 areas, or these 8, different parts. And it really kind of helps us compare and contrast approaches. And in my unifying framework, I teach people how to use, all of these different concepts at one time. But what's really fascinating is we talk about this here. So one of the things that IFS does is looks at the complementary patterns. They won't necessarily track behavioral patterns as, directly. I mean, all theories touch on all 4 of these levels in some way, shape, or form, typically. But then what I have here, the primary focus of the approach is they're looking at these complementary patterns, and so we're looking about how, you have the vulnerable parts, and the managing parts and the firefighters who are trying to keep the vulnerable parts safe. So that is what we call a complementary pattern. And one of these days, I will write a book on complementary patterns across all of the major 50 psychotherapeutic theories, because that is really where case conceptualization happens in all the different approaches. And each approach uses very different language. But at the root of all of them, there are these complementary patterns. This is certainly where IFS, in my opinion, overlaps with some of the psychodynamic approaches, because we're definitely working with complementary patterns. And so also in systems, we talk a lot about polarization, right? And so you will see that is very central to the conceptualization, what we're going to talk about here. And then was kind of fun, when I looked at the emotional level with IFS, I realized that you have, so in the Unifying Framework, we talk about what we call primary emotions, which are attachment-based emotions. So do I feel safe in this attachment relationship? And then secondary are the more reactive emotions. So these are the expressed emotions that you typically see at the top. This is where I got a big aha moment here, is that the exiled vulnerable parts we'll be talking about today, they really line up with attachment-based emotions, that very primary, am I safe in the world? And that the reactive emotions, what we're going to be talking about, the firefighters and the managers, those are secondary emotions. So that's, when we look at the emotional level, IFS clearly has a way to capture both of those. This is why I have so much fun with my Unifying Framework. Anyway, and then when we look at the higher self and the parts language, they really get into identity narrative work more than cognition and beliefs. They're working on identity narratives, that higher self, the more centered self. So it's really fascinating to look at where this particular approach falls on the Unifying Framework and what pieces it really works with. So hopefully that kind of helps you think about this as we move through. I got a lot of ahas out of it. Okay, so, the juice. So if you're familiar with my textbooks, you know I like to have this. I like to pull out the juice from all the theories I write about, and to really highlight, no matter what approach you work from, this concept I think is really relevant, no matter what your primary approach might be. So I think this concept of that each of us, we have within us our inner system, our inner self, we have multiple parts. And, oftentimes people talk as though humans are supposed to be, consistent, and, big criticism you can get is, you're so hypocritical. I'm like, yeah, humans are hypocritical. We're all hypocritical because we have this inner dialogue where we contradict ourselves 1,000 times a day. Yes, we have multiple perspectives in our own mind. And I think people often like to talk about, or people like we're all logical, like we are rationally logical creatures. And when you do this work for even a short amount of time, how our emotions and beliefs and who we, strive to be and who we actually end up being, right? Or what our behaviors are and what our aspirations are. There's a lot that doesn't match up. We are very complex. Identity is very complex, right? And so, I think, just understanding how we do have different parts that can, appear in different contexts and different relationships and different contexts in life. And so appreciating that as a mental health professional, I think, is really a valuable experience. And sometimes I can hear people talk about their clients, but my client is, good at expressing emotions, let's just say. And I can tell you in some contexts, and not in others, right? Or, so just understanding that whenever you're looking at someone, that's just one part of what you're seeing of them, and that there are multiple other parts within each of us. So I think that is a very useful concept. Another thing that I really appreciate and love about this, and I do think there is some information from even like Buddhist psychology, but I think one of the most remarkable things, and if you're going to do this approach, this is one of the things to really understand, is that they don't see some parts as good and other parts as bad. which is central to systems therapy, right? We're trying not to find, to blame any one person on the system. And in IFS, they're doing the same thing with the internal system. And so even when you look at, let's say, the part of a person who makes them want to cut or yell or avoid or whatever it might be, right? That part may not be informing the best behavioral decisions, but it's not vilified. And I think in today's world, where everyone's so quick to slap a label, they're a narcissist, they're toxic, they're this, they're that, having this appreciation where you're not labeling parts as one part is good, one part is bad. They just have different needs, roles, and functions. And that what we need to do is get the self in charge so that they all work well together. That is really, really powerful. And I think because if you start getting into, there's some good parts and there are bad parts, right? There are parts I like, there are parts I don't like. You get more polarized. And if you look at, psychotherapy you can start from psychodynamic, humanistic, CBFT, systems, postmodern. You look at almost any system of psychotherapy, any major school of psychotherapy, and they will tell you that when we get polarized, whether it's interpersonally or interpsychically, right? When we get extreme in our behaviors, health does not follow. And that health requires being able to work with all the different aspects. And so when you vilify, you polarize. And when you polarize, you tend to get psychopathology or interpersonal problems. So understanding the role that each part plays in the system is really powerful. So yeah, so what the therapist is doing is helping clients to understand these different parts of the self and these inner relationships to help the different parts work together in a more effective way. So let's look at the therapeutic relationship in IFS. So they describe the therapeutic relationship as a collaborative one. And kind of the working assumption is that people are highly competent at their core. So there's a highly competent, self at their core. And that our job as the clinician is to create a safe environment for clients to explore their inner worlds, especially those more vulnerable parts, And so that is our job, is to create a lot of emotional safety in the room, a lot of acceptance. That is where when you start judging parts as good or bad, even if it's just kind of implied, right? You got to even be careful how you use your metaphors. So understanding the more vulnerable parts and to create this safety, which means you're accepting all of the person and not, it doesn't mean you're saying that part that makes you want to cut, we're going to befriend them and let you cut. That's not what we're doing here, but we're not turning that part into a bad part of the self. So much of how to make this approach work is that the clinician really has who you are as a human being and the work you've done with your own parts to be able to tolerate those tensions. And in Buddhist psychology, we call it acceptance, right? Of all of who we are, all of these kind of conflicting parts, to that the clinician needs to have done their own work so that they're able to guide others in doing this work themselves. And all I can tell you is when you haven't done the work and you're just using the vocabulary, you come off as very much in your head. You're kind of clueless and you don't know how to create the right level of safety in the room. So the one thing I really encourage you, because this can be a very profound type of work, especially when you're working with something like trauma, is to make sure that you've really done your own homework on you. The self, the clinician, is so huge. So that you're able to really tolerate those reactive parts, and clients can feel when you get it and when you can handle their stories. I've done a lot of qualitative research, and I was really surprised how many clients would say, I could tell my therapist or counselor was getting anxious when I would talk about heavy subjects. And so I just avoided those. And so all I can say is that you learning how to do your own work, and to stay very present in the face of difficult emotions without where the client truly knows in the depth of their being that you are not judging them and that you're able to befriend these vulnerable parts that they've been trying to hide away from the world, that you're able to interact with them in a safe way. They will know that, and it's not something that you can fake. So let's talk about the case conceptualization, or what I call the viewing in IFS. So the main thing to understand here is there is this self that's kind of the seat of consciousness. I do a lot of work in mindfulness and meditation. And so I think of this as almost like the observer. So when you look at mindfulness, right, there's always that part of there's the part of the mind that's observing the rest of the mind in action. I mean, that's what mindfulness is. And philosophers from all over the globe have pondered for centuries, who's the part that's observing? And there are measures for this. They actually can measure this ability. And that's something actually, when you practice mindfulness, you get better at observing your mind in action. But the self is the seat of consciousness. It's this central self that is not reactive to the world. It's able to observe the inner world, those inner parts, right? And it's considered the natural leader of the internal family system. So this seat of consciousness, this part of us that's able to observe what is going on with compassion, wisdom, and understanding without reacting to it all, because that reactivity are the parts. The self is that centered part of yourself that's able to observe it all and not freak out. So I do, in my Therapy That Works course, I do recommend anyone who does this work to practice mindfulness, not to become spiritually enlightened, but to become able to observe your thoughts and your emotions, kind of move through your mind and not react to them, not get carried away. And acceptance and commitment therapy, they use a metaphor like you can watch the train of thoughts go by. You don't have to jump on the train. You can just watch those thoughts and emotions go by. You don't have to identify with them. You don't have to, claim them. You can have a thought and disagree with it. So it's very, you don't have to believe everything you think, is a fun saying in mindfulness, because thoughts will go through your head. Half of what we're thinking and feeling, I would say, come from outside of us. They're what our friends or family opinions, dominant discourses, society's opinions, some love song we heard, whatever it might be, right? But half of our thoughts aren't even our own, half of our emotions aren't even our own. And so learning how to step into that kind of observing self of consciousness, to watch how the parts are interacting in this approach. I know I slipped into a little Buddhist psychology right there. Getting back to IFS, to be able to watch your parts interact from a kind of, it is a compassionate, but it is a neutral, unbiased place where you see all of this kind of interaction, the parts interacting, and not getting sucked into it, pretty much. So when you are, so I think I'm so sorry. I did all this. I needed a few more photos to be dropped in. I think my assistant went in and took all the capital S's out. Those should all be, when we talk about the self and IFS, the S is supposed to be capitalized. And again, I apologize. So when the self is leading, you experience inner balance and harmony. And so there is this, you can have all those reactions, right? You can have emotional reactivity, but the self still stays in charge. Even when you get triggered, the self is in charge, and it's able to see, yeah, so this vulnerable part of me got really scared because X or Y and Z happened, and the manager's coming in or the firefighter's coming in, and you're able to watch it all from a compassionate, you're not judging yourself. There's this compassionate understanding, watching it all, the inner world play out without being like reactive to it all. And so what happens is, especially with trauma, is that the parts are trying to protect this higher self. It's not that they don't call it a higher self in this approach, trying to protect the self with a and so what's happening is, especially after a trauma, the parts are trying to not have the self be in charge, just to create a super amount of safety for those vulnerable parts, right? So they're trying to kind of remove the self from leadership because the self is a little too open for the vulnerable parts to feel safe. And so that's what we're doing in this approach. Okay. So let's talk about the parts. So there are three main types of parts. You can have multiple versions of each of these, but there are three basic types. So the first are what we call the exiles, and this is where our vulnerable emotions are. This is what I think, in at least the way I see it, is whenever you look at the unifying framework for psychotherapy, this gets at the primary attachment emotions, and this is like that reactivity we get, especially like in couple relationships. You'll see this really get triggered. And what happens is these exiles are the highly vulnerable parts of us. They get closeted away because of the shame, the guilt, not feeling lovable, not feeling worthy, being very fearful. So the exiles are the highly vulnerable parts of ourselves. Definitely can be formed through trauma or just, major disappointments, losses, in one's life. So those are the exiles. Next, we have the managers. And so the managers are kind of like they sound. They're usually pretty reasonable, and they just keep those exiles locked up nice and safe, right? So the person doesn't get they don't get escaped. There's no flooding, right? You don't have to, keep those, kind of strong, painful emotions just kind of locked up. And so the managers are going to try to be as reasonable as humanly possible to just, keep the exiles all kind of locked up and keep them safe and try to just move on being as normal as humanly possible, right? So those are the managers. That's, could be, various types of coping skills, like being super organized, right? Or worrying or people pleasing, right? These are all different ways, parts of us where, many of us have several different ways that we manage those vulnerable parts of ourselves. And then you have the firefighters. So when the managers fail, and I think of the managers kind of using the more reasonable, generally socially approved ways of handling, the exiles. When the managers fail, and despite their best logical, reasonable efforts, and the vulnerable parts come out, so you kind of go into crisis, you get triggered, right? Then the firefighters come out. They're like, you managers, you have failed, so we're going to have to use some more extreme measures. So these come out to rescue and contain the vulnerabilities when they kind of get triggered. So they will use more extreme methods. You could, things like self-harm could fall under firefighters. Throwing a tantrum, yelling, screaming at someone can be, a form of firefighters. But these are kind of extreme, generally not socially acceptable, ways of managing intense emotions. So the firefighters are the heavy hitters who come out when when the vulnerabilities, when the exiles get out and you need to get them, round them up and get them back again, you'll have your firefighters coming out. So here is a really important point that I talked about in the juice section, that all the parts are valuable and they can be constructive, in the right context. And I like to always say that every behavior, every ability, every symptom, right? If you read my textbooks, I always talk about there's a shadow strength to every symptom, every DSM. Worrying, right? People who are worrying is a problem in one context. It's really great future forecasting and problem solving in another context, right? If you're planning a long, complex trip or a big party like a wedding, you want someone who worries a bit because they're going to, identify potential problems and solve them before they happen. Okay. So similarly with these parts, in one context, they have a skill set that's problematic. In one context, in another context, it would be a strength. And so realizing that all of these parts have value, and we just need an effective leadership for knowing when to use which part of ourself. And that's kind of the concept. And I think the very important piece of doing this work well is this incredible acceptance, right? For whatever, the problem might be. Like, I like to joke about, a little ADHD goes a long way. Like when I'm hiring someone to be my assistant, right? In this case, she's doing a great job. She's finding all the capital. I'm always like, I want a little OCD. Well, not ADHD. Yeah, well, ADHD has its place too, but OCD, I was thinking, a little OCD goes through and they find all the typos, in my PowerPoints, which, clearly she did. And she took all the capital S's out because I didn't explain this to her. But that is a really good skill. But in another context, someone who's that attentive to detail, right, and fixing them can have other forms of anxiety or OCD or that sort of thing. So realizing that all of these parts, especially if they're causing problems for us, let's try to understand them, what motivates them, what their skill set is, and with effective leadership, we can have them functioning, helping us function better in a different context. So the problem really is polarization, and you will see this across every single psychotherapeutic family therapy approach there is. So what happens is when a part begins to assume leadership rather than the self, well, there's a capital S. So when a part begins to become in charge, okay, like with OCD is a good example. So in OCD, the part that's worrying a manager who's very worried about, let's say germs. Okay, we've got the germ phobia, right? So when they take over the leadership and the self, the more neutral, compassionate, all-seeing self steps down, OCD takes over and that manager takes over, you're going to have this, the system's going to become polarized. Okay. And they're doing this to really make sure those vulnerable parts stay locked up and safe and don't give us, any other trouble. And so the more vulnerable a person might feel, the more they need to take extreme precaution measures to protect those vulnerable parts. And so in this approach, when you see someone with maybe, let's say, more extreme OCD, you would interpret that as there's some very vulnerable parts that are needing lots of protection, is how they would see the polarization. And so you can also see this obviously in real families, right? You have the good kid, good parent, bad parent, right? We see this in families all the time. So what we see in families can also happen within ourselves with the good part, bad part type thing going on. So external family systems. So in internal family systems, they also look at the external family system as well. And it's really, I think, very convenient to be able to use the system metaphor both for internal world and external world. And they conceptualize this very much in terms of burdens and constraints that throw this system out of balance. Okay, so when you're looking at it at the interpersonal systems, family systems, they're looking at burdens or constraints that have created imbalance in the system. And so one type of burden that they look at are what's called a traumatic burden, but basically there is some kind of abuse or a sudden loss that puts a burden on the family system and kind of like a monkey wrench in how people relate. There are environmental burdens, right? So these are the type of burdens from the outside world of what's required to be a successful family to be valued. So I can do a whole workshop on how bizarre it is, I think, in the United States, how we raise our kids these days. And there are 18,000 teams. And, oftentimes couples don't see each other because they're just running around getting their kids to all their activities and helping them excel and becoming, an expert at this and running their YouTube channel and making sure they're an accomplished musician and a top rated, sports person. So these are an environmental burden on the families, how, family systems function, and even the burdens from the outside system, where in the United States, I think families have a lot less support than many other countries or comparable countries in terms of supporting families in raising children. Then there are things called legacy burdens, and these are values and beliefs and sometimes literal burdens about that are handed down intergenerationally. Okay, so if you're familiar with Bowen systems work, these are the legacy burdens, the intergenerational patterns, but shame that might go down through perfectionism, performance expectations. Everyone in our family goes to to the XYZ type of university, or they're always whatever top person on a sports team or whatever it might be, or we always look perfect, or whatever it can be, or every family's different, and you get these legacies that become a burden on the system. Other terms of systemic imbalances come from what they call developmental burdens. So just difficulty adjusting to the demands of the different family life stages, family with, young kids, families with elementary kids, high school, launching, right? Death, birth, all of these developmental burdens. It's development of the family system, which is based on the development of the individuals. Then they're just tangible burdens, right? Like real burdens, things like chronic illness, poverty, disability, right? Dealing with marginalization in their communities. So looking at the relative balance or imbalance of how these tangible burdens are affecting the system. And then also, in addition for looking for all the burdens, the therapists also look for, what are the strengths, right? So what creates family harmony? When does the family or the, the relationship, when is there harmony? What does that look like, and what makes that happen? Okay. Then they also will look at the part patterns between two people. So we've assessed the internal world of of an individual. We assess the whole of the family system, and now we're looking and assessing when our clients, and most of them are, complaining about their relationship with a partner or a parent or a child or whatever boss or whoever it might be. We're going to look at what parts of each person are interacting to cause the conflict. So in this case, we're going down to between two people, what's going on, what parts are being activated. And so there's several different types of patterns that might be happening. So they're usually either polarization, meaning, people are taking opposite roles, or there's enmeshment where each person's part is actually blending into the other. There's totally fused and enmeshed. So when you have something that's called a manager-manager polarization, this is where you get straight up conflict. I think it should be done this way. I think it should be done that way. And we're going to argue about it. So that's how managers relate. They will have a head-to-head kind of argument over point for point. This is my position. This is my position. And we go at it. That's a manager-manager. And so they're just trying to understand. And then what they would do is work to identify what's going on for this manager, what's their goal, what's going on for the other person's manager. Then you have a pattern that's called the manager exile polarization. So in this case, one person's manager is interacting with the exile of another person. So this is typically we're going to see some really over-functioning caretaking, because you have someone's manager self kind of interacting with the vulnerable part of someone else, and this person, the relationship becomes imbalanced, especially if it's a couple. Because one's doing all the caretaking. I would call this the over-functioning, under-functioning pattern. But even with a child, this is a problem. And I see this all the time in my clinical work, where, if a child's able to do something for themselves, the parent should be encouraging them to do it, right? And so, so even an over-functioning caretaking parent, but yes, caretaking is part of the parental role. But if the parent isn't adjusting that as a child gets older, they're going to hit 18 or 22 or 25, and they're still not able to take care of themselves, manage their inner world, or do any of that. So you can even have manager exile polarizations with parents who really overfunction for their kids. And I think we see a lot of that in today's world. Then you have the manager fight-or-fire polarizations, which is kind of got a control and rebellion pattern. So one person's controlling, the other person's rebelling against it. Obviously, this is most stereotypical with teens and their parents, but you can certainly see this in couples. You see it in work relationships all the time, where you get this kind of almost a rebellious response. And then there's kind of what we would call enmeshment between the parts. Enmeshment, if you're familiar with structural family therapy, kind of comes out of that approach. But this is where the identities really kind of get fused. And so there is caretaking often in this enmeshment, but the identities get fused. They talked about, patterns of being the redeemer, but there's this extreme kind of fear of loss of the other. And so the identities get blurred and fused. So these are just some of the patterns that the clinicians will look for to help when they're working with strained relationships. Okay, so let's look at what goal setting looks like in this approach. So the goal is what they describe as self-leadership. And so this is where healthy functioning of the internal family system is defined by self-leadership. And that means that the seat of consciousness, that kind of non-reactive part of the self, what I would call the observer self in mindfulness, is in charge. And it's able to successfully organize the parts, bring out the best in all the different parts, and make them work in harmony. So when self-leadership is realized, the parts do not disappear. okay? But what does happen is there's just less of these extreme polarized roles. They work together to help problem solve with each other, and they're helping each other out. And each part is viewed as having a valuable role. So even if you do feel vulnerable, right, the self is able to work with that part, maybe bring in some of, a manager's cool, calm reserves in order to have an effective response to whatever might be going on in the environment. So you feel hurt by something your partner said, rather than react, right? Either a firefighter or, might come in with yelling and screaming or crying or cutting, would be a firefighter response to your partner upsetting you. Or manager might just get really maybe more detached, or get into cleaning, or get into this super hyperlogical response. The self is going to, look at all the parts and help create an effective response in the given situation that works, rather than just reacting kind of mindlessly. So yeah, so the self is able to step in and mediate when the parts start, the exiles, the managers, and the firefighters start being less cohesive, not working together well, and getting reactive basically to a situation. So that triggered response. And it's funny, I hear so many people talk about, they triggered me, and, that's the problem. And it's like, okay, you know what? You're going to be triggered for the rest of your, there's always going to be people doing things that could trigger you. And it's your self-leadership, that's going to help manage those inner parts so that you have a skillful response to it. And so, and it doesn't mean you don't go and, talk to your partner, when you do X, I feel Y. Can we talk through this? Can we find better ways of doing this? So that's what self-leadership goes and has a productive conversation about how you got hurt, rather than getting a knee-jerk reactivity and yelling, screaming, crying, pulling away, getting distance, being passive aggressive. Those are all parts who have taken over control. Whereas when you have self-leadership, you're able to sit down with, okay, there's a part of me that wants to pull away right now, but I know that's not the best response. And so, how do I use my managing skills? How do I get in touch with my vulnerable parts and find a way to express those in a healthy way? So that's kind of the difference when we talk about self-leadership. That's a difference there. So let's look at the interventions in this approach, or some of the interventions, obviously. So the first thing is introducing parts language. And so, so the simplest way to do this, and even though I don't work in a purist IFS way, I've used part language, and I think you see it in Gestalt work, you see it in even some of the postmodern work, like narrative therapy. We'll talk sometimes about sort of parts of the self. They externalize it and normally don't call it a part, but it's a similar concept. So often just in summarizing, right? So you're listening to your clients, there's a part of yourself that is, excited about what's going on right now. And there's a part of you that's really scared about what's going on, right? So that's pretty natural language. And I think when you honestly, sincerely see people like that, it's not this artificial thing. And this is where doing your own work really helps, because it'll just be very natural. And I use this a lot in just summarizing what my clients are saying. I don't just summarize, one perspective of them. Normally when clients are talking to us, they have multiple thoughts, multiple feelings about the same thing. And so you can just summarize that by saying there's a part of you that's feeling this or thinking this. There's a part of you that's thinking or feeling this. Part of you wants to do this, part of you wants to do something else, right? So you just naturally can move into that language. And so you can also then inquire about this inner dialogue, about the one part of you that's really excited about this relationship, another part of you that's really doubting this new relationship. Can you tell me what, how that conversation goes in your head? Have that all the time. So just helping them explore those conflicting thoughts. And this is where I think that the mindfulness practice is so good for mental health professionals, because when you realize we all have contradictory thoughts all the time. And if you're having a conversation and your client has this linear level of logic, you're usually missing half of that internal discourse. So something to just think about in general. Yeah, and the key really is if you use it naturally and tentatively, then you'll see whether or not it fits for your client. And so in terms of, I think when you use the part language in a really mechanistic way doesn't feel natural or sincere, some clients will rebel against it because it's too kitschy. It's too, I can't find a better, it's too contrived. It's not sincere. It needs to be sincere in how you're talking. It needs to be sincere and kind of reflecting what's going on with the client is really important. Oftentimes clients feel very relieved to know that none of these parts are bad within themselves. And so typically, you know, and for some clients, you will find that this part language is really powerful. It really resonates because there is like this war going on inside of them. You know, I like to talk about how clients only come to us when they have dilemmas, right? And with those dilemmas, you've got different parts who want different things, and there's no way forward that has everything. There's no option in front of you in life right now that you like. So you end up with a lot of parts kind of arguing. I often liken it to you've got 3 or 4 possibilities of how to move forward in your life. Truth is, you don't like any of them. And different parts of you like different doors, right? Different options for moving forward. And so this language can be very powerful if people are experiencing dilemmas, which typically they are when they come to see us. And so you can go in and do even psychoeducation, especially describing the self and then the 3 types of parts, the exiles, the firefighters, and the managers. You know, with some clients, you'll really get into doing a bit of psychoed on the model itself. And typically you would if you're working from this approach. The next, you're going to start looking at the internal relationships that a clients have. So you're going to be tracking the relationship between their higher self, so to speak, or their capital S self and the various parts. And then you're also going to spend a lot of time looking at the relationship between the parts, right? So when this vulnerable part, you know, breaks loose, you know, how does the manager, how does the firefighter work, right? And so one of the guidelines, one of the things they talk about is when you are changing an extreme part, okay, let's say you're working with a part that abuses alcohol or cuts, right? This polarized part, you always want to make sure that you're looking at the opposite part, you know, maybe the highly vulnerable part that needs to be protected, which is why we're drowning our emotions, because I feel so hurt and devastated, you know, that my partner said X, Y, Z. So you always want to make sure you're working with the polarized part. So, and anything that helps the parts trust the capital S self helps the therapeutic process. So you're trying to get the parts to trust the self to make good decisions to keep everyone safe and happy. So these are some types of questions that could be asked when you're kind of assessing the internal relationships between the parts and the self. So you can ask someone about how do they feel about, let's say, you know, this vulnerable part or the firefighter fighting part of yourself. Why do you think that part does what it does? How often do you hear from that part? How often is that part activated? Why do you think these 2 parts relate to this in this way, right? How do you think that, how do you want this relationship to change between the parts, right? Not between them and other humans. How do you want the relationship between the parts to change? Are you ever good at calming down this particular part to get them to manage less, to firefight, to chill out as a firefighter, or even for a vulnerable part to feel calm and safe? So you're going to, you know, actually talk about the relationship between the different parts of the self. Then there's something called blending. Okay. So blending is when the vulnerable parts, the blending would be when the vulnerable parts kind of overthrow the self, the manager, or the firefighters to take over the system. So this highly vulnerable, you know, part of ourselves is shameful, guilt-ridden. We don't want the world to see it, right? It's really hurt, this wounded part of us. They're blending it's this fear that part's going to be the part that ends up in charge of all of us, right? So the managers and firefighters are really working to stop the blending, stopping from having the exiles take over the system. So in terms of controlling blending, the clinician is working with clients to make sure that they don't get activated. So when you are, you know, touching upon, especially with the vulnerable parts, you want to make sure that you create enough safety in the room through the therapeutic relationship, through the interventions that you're using, that the client doesn't get flooded basically and have those vulnerable parts totally take over, and they're, you know, kind of feeling totally out of control with these vulnerable parts, you know, taking over the system. So it is the clinician's job to make sure they create that safety. Yeah, and so you can even explain to some of those exiled parts. We'll talk about using a technique like the Gestalt empty chair, where you're going to actually literally talk to those parts saying, you really don't want to be in charge. You want the self is going to help create the safety that we need. So we need you to kind of work with the self. And they will sometimes do it that literally as if it is its own person entity. And so, and also when the managers want to come in and maybe shut down the emotions or get really logical or get kind of theoretical or whatever it might be, you can also calm down the manager and say, hey, I know you're just really wanting to keep everyone safe, but right now that's my job. I'm, as a therapist here, I'm going to keep everyone safe. So we can just, put down those managing, techniques that you use as, I'm here to help create that safety. So they do use a lot of insight in imagery. So insight is seeing inside. And so they creating imagery for each of the parts. So you might come up with an image, let's say, for the let's say there's a part that's super type A and in control. The image might just be of a lady with a clipboard with little glasses or whatever it might be. The vulnerable part, you can have an image that comes to mind when they think of the part of them that's fear of being judged. It could be like a little kid, curled up in a corner type thing, that vulnerable part. So coming up with images can help the person work with these different parts, especially when we start doing things like dialoguing between them. It helps externalize in a sense, similar to narrative therapy. So rather than it's just this overwhelming emotion of shame, let's say, you have an image of a child, kind of scared in a corner who could be the image for the shame. It creates this externalization that allows us a lot more cognitive room to interact with those feelings or thoughts, whatever it might be. But in this case, I'm thinking feelings of shame. Now you have this image to work with that really makes it easier to find new ways to relate to what's going on. So this is going to be very powerful. One of my favorite techniques is the room technique. And this is a type of visualization. It almost feels like a guided meditation to me. But this is when you get into, when you're working with really overwhelming parts, such as when you're doing, let's say, trauma work, right? And you have these really overwhelmed parts. I love this. You tell the client, we're going to take that. Let's say there's this very angry part of them, right? And it might just be, they might see it like this raging Tasmanian devil type monster. I'm thinking of the cartoon, Bugs Bunny cartoon. I think it was Bugs Bunny, Roadrunner, maybe, if you're old enough to know who those people are. And you're going to take that, angry Tasmanian Tasmanian devil cartoon character, and you're going to put him into into a safe room, into a room where it's totally safe. You can shut the door. If you need to, you can lock that door if they need that to feel safe. And so you're going to, and then you're going to walk your client around and have them observe that part from a window so that they can be a little more detached, right? And not in a bad way, but kind of stepping into that observing self way where, well, let's look at this very difficult emotion and not get flooded by it. Okay. Someone is informing me that it was actually Bugs Bunny. Okay, good to know. So, and I'm remembering because it's like a metaphor that it's the character one of my clients is used for that. So anyway, stuck with me. So you're gonna, what are you noticing about this part? What are they doing? What are they, do they say anything? Why do you think they're upset? What do but you can do it from this kind of detached, quiet observing place where they feel safe. So you're not triggering the emotion. This is kind of helping with the blending, right? You're not triggering, and they can often have this conversation sometimes, with this part. Or at least if not a literal conversation, but get to see it, experience it without being flooded. And if you do trauma work, this is so important. And then that sets you up, if you want to, sometimes for what they call direct access. And it's very similar to a Gestalt empty chair, except for instead of another person, you're putting a part of yourself there, and you can have yourself talk to a part. You can have two parts talk to each other, set it up any way you want to. But this is where you ask the client to talk as if they are. We're going to just go with the Tasmanian devil because, that cartoon, the angry part of this person who I worked with, And so you'd say, I want you to just talk for a minute. I'm going to ask you some questions. I want you to respond as if you are that angry part of yourself, right? And so you allow the client to just, so you can interview them, so what upsets you the most? And, when did you first come into this person's life? Um, and so it can be very, very powerful in terms of working with that part, of having the person be able to access it without being flooded or overwhelmed, to get insight into, and hopefully have compassion. Because the truth is, you want to have compassion for all of these parts. And that's a real important part of this work. It's not like you're a bad part because you get angry. We're not chastising these parts. We're like, oh, so this is what really got you upset the first time. And then these things have happened. And so when this happens today, this is what it feels like for you. And so you should be having a compassionate experience, for the part that you are interviewing and working with. But then noticing shifts in either voice or body or language and how people, talk or present themselves, you'll often notice very clear shifts in how they are just speaking. And so just noting that, reflecting on that, again, nothing's good or bad. It's just, we're noticing. So when you're talking as that angry part of yourself, there's this strength, there's this, you talk, in a more strident way, you actually have confidence, right? What you may find is that angry part actually hooks them into a deep sense of confidence because, hey, I was mistreated. And so you can reflect on that confidence that comes across, and so then, down the road, when we talk about the self-leadership, being in charge and knowing how to use the parts, okay, we learned the angry part has a bit of confidence. So how do we bring that confidence into a situation skillfully to have better results? And so you're using this direct access in that way. And then they also use, get into working with the body. A lot of IFS originally developed in terms of working with people who had, severe childhood trauma. So we know that the body keeps score and that trauma can really reside in the body. And so with IFS, they will also work with these embodied parts. So some of these parts really do have distinct postures, gestures, voices, facial expressions. Like the vulnerable part might be expressing themselves in one way. A manager might be a totally different way. The firefighters, yet a totally different way, right? So just noticing these differences. Sometimes the embodied parts can actually come up almost as physical sensations of numbness or cold. Adding weight for protection is another way a part might show up. And so looking at how these might be related to adverse childhood experiences, and then actually using body arts like yoga, martial arts, mindfulness to help work with some of the embodied dimensions, maybe I would say, of the parts. So that's another way that they work with the body.